Hey y'all, it's Dr. Shelly and we have another video for you. This is on gout. Gout is a type of arthritis, and of course you may have caught the other video that we did on osteoarthritis. This goes in the ortho playlist. Now if you have my materials, you probably know when it comes to ortho or musculoskeletal, there are actually these two handouts, ortho joint replacements that we use. The ortho handout is for acute conditions, and the joint replacement is for your chronic musculoskeletal conditions or chronic ortho. We are using the joint replacement handout, and in your joint replacement handout, we will be talking about the actual handout in here. It has in here anti-gout, okay? So if you can pull that up, and then you'll probably see handouts that have corticosteroids on them, and you might see NSAIDs and that sort of thing. So you should be okay if you have those handouts. So we're gonna get started. Now, I want you to remember that when it comes to this condition, it is a type of arthritis, but it's an inflammatory type of arthritis, not rheumatoid arthritis, which is another inflammatory arthritis. This is a very separate, different type of arthritis, inflammatory arthritis, if you will. So if you look up here, you see the big word gout, and then you have here my definition. It is your body's inflammatory response to high uric acid levels in the blood. How high would you go? Well, it says in the textbooks and the different authorities, higher than 6.8. Higher than 6.8 uric acid level in the blood is considered quite encouraging for gout to flourish, okay? Now, gout is a type of inflammatory arthritis, and it can be acute or chronic. So that's important because you have people where they've had one flare of gout in their whole lifetime. You have people that keep getting gout flare-ups every month. You have people that their gout flare-ups are triggered specifically by certain things they ate or drank. You have people who can't predict when they'll get a gout flare-up. So it could be acute or it could be chronic. And that does matter as to how we treat the patient. Now, these risk factors, oh my God, these risk factors are so important for you to understand, because the same risk factors for gout are the same risk factors for a lot of metabolic diseases. So let's look at the risk factors for gout. I bet you know one of them. I bet you know what I'm gonna say because I've been saying it every single video for the musculoskeletal section. I've been saying it quite a bit. Look, obesity. Obesity is one hell of a risk factor for gout. Age older than 50, men more than women, although don't get it twisted, women can have gout. I know those women. But obesity, age older than 50, the male sex, alcoholics, drinking alcohol, specifically a lot of beer, diabetics, chronic kidney disease, because when you have kidney disease, you can't excrete the uric acid. Makes sense. Genetics, some families tend to have more gout than others. The use of loop diuretics like furosemide or bumetanide, especially the use of thiazide diuretics, which is your hydrochlorothiazide or HCTZ, and also the use of aspirin, acetylsalicylic what? Acid. ASA, acetylsalicylic acid. Here's a big one. It's in a square. You know, if I put it in a little red square, it's probably a big hairy deal. This is high fructose corn syrup. The fuck is that? Well, high fructose corn syrup is basically pop, juice, a lot of fast foods, a lot of baked goods, chips, all kinds of things. We'll talk. A high purine diet, and this is a little controversy, but for your purposes, which is to pass your NCLEX or your HESI or your ATI, you want to remember red meat, organ meats, beer. Beer is huge. I need you to know beer for real. Seafood and shellfish. Boom, you got it, okay? Now, complications of a patient with frequent gout flare-ups. Complications is renal calculi, which is another way to say kidney stones. These patients tend to have a lot of kidney stones because remember, kidney stones, some of them are made out of uric acid. Chronic kidney disease as well. This is a complication where you just kind of keep getting gout. I mean, this is what we see. Now, what is your patient going to feel? Because it's really, really, really bad. This, I have heard women say, is worse than labor without an epidural. And I'm an OBGYN. I also have 2 children. I got epidurals with both of them. I can't imagine. So women say that the pain of gout is worse than labor without an epidural. OMG. Now, men can't really compare what it feels like to have a baby, but they are on board as saying this is the worst pain they've ever felt in their life, okay? Now, we know that research-wise, we know that the worst pain on earth is pancreatitis and sickle cell crisis. But I guess gout must be pretty bad. So here we go, y'all. Signs and symptoms: excruciating, severe pain, which most patients rank a 10 out of 10, often in the large toe, but could also be in their knee, their elbow, their ankle, joints, right? Because what happens is that uric acid crystals get stuck in the synovial fluid, which is that fluid between the joints. These crystals get stuck in there. They kind of accumulate inside the synovial fluid of the joints, which is that, fluid that lines the joints. And then it sets up an inflammatory response to which your body produces like all these white blood cells, and the white blood cells congregate, aggregate, clump up around all the uric acid crystals, and that's what causes the outrageous pain. Ooh, okay? Then we have something called tophi or tophi, some people say. It's probably better to say tophi. Tophi is these yellowish nodules of uric acid in fingers or toes. You do have to Google these images. It's pretty impressive. It's like nodular bumps, lumps, tumors of this crystal, uric acid crystals. Like, oh my God. All right, so there you go. So how do we treat gout? Well, the number one treatment is prevented in the first place, right? So what do we say? An ounce of prevention is worth a pound of cure. Is better than a pound of cure, right? So what we mean by that is the patient who's had gout before knows that they never want to feel that again. They will do just about anything never to feel that way again. And so one way they can never feel that again is if they push fluids. Now, patients talk in terms of bottled waters. They just do. We've been a bottled water society for a while. When I say push fluids to 3 liters, so that you have a urine output of at least 2 liters a day. That sounds really cute and textbooky kind of shit, right? But that doesn't do anything for the regular person on the street, like the lay person. And I know that you're trying to pass the NCLEX or the HESI or the ATI, but I'm trying to make you the best nurse on earth. I am trying to have you take care of God's people in a way that makes sense, right? Like that's my ministry, to create excellent nurses and to change this world one patient at a time through nursing, right? That's what our nurses do. They change the world one patient at a time. So yeah, it's cute to say push fluids, go up to 3 liters in a day for your NCLEX or ATI or HESI. What the fuck does that really mean? Well, let's talk about bottled water. The traditional bottled waters you buy, what is it, a big old case for $3.99 or whatever at any store. If you think about those bottled waters, I need you guys to think about how each bottled water is basically 500 milliliters or a half of a liter. So if you are pushing fluids, like you're really pushing this patient to drink, the number of bottled waters, if 1 bottled water is 500 milliliters, then 2 is 1 liter. Well, they need 6 bottled waters a day. Now, you and I should be drinking 4. They need 6. I hope that helps, because you know how it is. You read all this stupid shit in the textbook and you're like, well, what the fuck does that mean? All right, so we need this patient to drink 6 bottled waters. And you kind of got to tell them it's water. And I hate water, so I understand if they get an attitude with you. And I don't know, maybe they can put a little flavor in there some kind of way. But what they can't do is think that you're saying drink a lot of fluids, because their idea of fluids might be iced tea, pop, juice, sweet tea. Oh my God, will they be back in your emergency room, right? All right, so we want them to drink at least 3 liters, which is 6 bottled waters. We want this patient to avoid high fructose corn syrup. Peep this out. Avoid high fructose corn syrup, no pop or soda, no juice. I know you're thinking, well, Shelly, juice is healthy. No, the fuck it ain't. No, it's not. Especially juice from concentrate. You know what's healthy? Real fruit. Remember when we grew up, everybody had a fruit basket on the center of their dining room table? You came in from school, you grabbed a piece of fruit, and you kept it kicking. Now we go to the fridge and we get this pissy ass juice, and it doesn't matter which one it is. They're all horrible. The only one that I'd probably even consider buying for children, which it's a stretch because my kids know, probably not. I made smoothies because I know that smoothies have fiber in them. Juice doesn't, and it's the fiber that lowers the blood sugar after you drink the juice, right? So the fiber in the fruit, which is why fruit's so healthy, it's the fiber that keeps the blood sugar low, even though the fruit is God's candy. It's nature's candy. Well, now you're buying all this juice, which was never a good idea. I know you thought it was, but it's okay. I'm your girl. You can hate me. But you're buying all this fucking juice. It has no fiber in it. There you are sipping your scissor, which is basically just sugar. I don't buy juice, okay? Stop it. Cut it out. This person with gout, knowing how painful that was, they should not be touching nobody's juice. The worst juice is juice from concentrate. You might as well just go ahead and take, I don't know, shank yourself in the kidney or something. I mean, it's pretty bad, okay? What else has a lot of high fructose corn syrup? Baked goods and breads. That's why I don't do it. I don't do bread. Stay away from that. Condiments, your ketchup, your steak sauce, your salad dressings, tomato sauce, whatever. Condiments. Yogurt, a lot of them. A lot of the sweet yogurts. Some of the dairy. Granola bars. Yeah, those things, you buy your kids, they just run out the door with the granola bar. Again, make them a smoothie, okay? All right. Canned soups, frozen foods, high fructose corn syrup. Fast food is number 1 after pop and juice. Number 1. We know how these guys are. A lot of men go to fast food every day. I mean, a lot of women aren't cooking. A lot of men don't know how to cook. A lot of young people are door dashing every fucking thing. Kind of like a problem. Breakfast cereals. Oh, yeah. Oh, I'm sorry. Rice Krispies and Apple Jacks and bunch of them. Just read the box. High fructose corn syrup is garbage. You know what I used to call it? High fuck your toes corn syrup. High fructose corn syrup is high fuck your toes. Why? Because your toes have gout and your toes get amputated, because all of this gives you diabetes. Now, chips. I love chips. You know I do if you know me at all. My weakness is chips. So the high fructose corn syrup that I get in my life, which is rare, is the problem is the chips. But chips are salty. So you might be thinking, what the fuck did they put the high fructose corn syrup in there? Good question. Inquiring minds like to know. Asking for a friend. Why did my chips need that? But you need to know chips, okay? Here's more advice for your patient suffering from gout. No beer, but then your patient is going to say, well, listen, you told me not to drink. I can drink. It's just I can't drink beer. I can drink my Hennessy. I can drink my Jack Daniels. Ain't nothing wrong with that. Well, sort of. Let me tell you. The beer is super, super, super high in purines. And purines, okay, let's just make sure we know what that looks like. Here you go, guys. Purines. Purines are the problem because they break down into uric acid. So beer is extremely high in purines. It's true. Stop that shit. What about wine and other liquors and your little Hennessy, white Hennessy, whatever you're doing lately? I don't know. Your Jack Daniels, your VSQ, what? Here's our problem. Even though those liqueurs or those alcoholic drinks don't have as high purine levels as does beer, when you drink, your body, and I taught you this before, your body prioritizes getting the alcohol out. So the liver metabolizes it, sends it to the kidneys to excrete as much alcohol as possible. When you're excreting alcohol, alcohol is a diuretic. The more you excrete the alcohol, the more it's a diuretic, the more you become dehydrated, and the less it had a chance to excrete the uric acid. That's how alcoholic beverages work to kind of be bad all the way around. So yes, it's beer, but it's also all alcohol. And that's just real. Sorry, I don't drink. I don't, every blue moon I have a cocktail on a cruise ship, but really, okay. Here we go. This patient needs a carbohydrate controlled diet because we know that sugar is stored in the body as fat. Fat leads to obesity, and I could go on, but I won't because that's in diabetes video, okay? Lose weight. I've been saying it over and over and over again. Lose weight. I know it's hard. Believe me, I know. I mean, your girl here, 60-some years old, I mean, I'm like looking at weight like it's like, I don't know, the devil. And it was really hard to lose it. I didn't even lose as much as I could until I went on those little weight loss shots, those GLP-1s or Ozempic. You know what I'm talking about. Try it. You might like it. It might work for you. Talk to your doctor. Get somebody to get it. Go to the weight loss clinic. Find out how to get them, child, but get them because they work. Move your ass. Shit, get up, okay? Do the stairs on the way to work. Stop taking the elevator to 2. Stop parking in the beginning over there in the pregnancy lady spot. Walk a little bit. Shit. All right, now let's look at medications. Pharmacology. I gave you non-pharmacological remedies right here. Let's move on to medication remedies, right? Pharmacology. NSAIDs are wonderful, but what are they? I don't assume that you know what the fuck NSAIDs are, so let me just say that. But the NSAIDs mean non-steroidal anti-inflammatory drugs. What are they? They are not aspirin. They are not Tylenol. They are Advil, Aleve, Motrin, and ibuprofen. Okay, you got that? Good. Now, so NSAIDs. Anti-inflammatory medications that are not NSAIDs, but they are in the anti-inflammatory family, is colchicine. I promise you, you might have to know this drug, colchicine. Okay, colchicine is only going to treat the pain. It's not going to lower the uric acid. If a patient is suffering from chronic gout, just this pain relievers won't be enough. If they only had a flare-up for once in their life, we can get on top of their pain, they never get another flare-up, fine. But if the patient is having chronic flare-ups of gout, then we need some medications that are going to keep the uric acid low. Look at this word, allopurinol. All purine is kept low. Okay? Allopurinol. All purine is kept low. All right? Purine breaks down to uric acid. This is not a hard drug to remember. Probenecid, I don't have any tricks other than acid. Cid is at the end. Probenecid lowers the uric acid as well. Febuxostat is a newer medication, and you cannot use it with coronary artery disease. It is newer. It will lower the uric acid as well. But then we have, in case any of those meds, or all, I should say, in case all of those medications don't work, and a last resort is what we really need, then we have something called an IV infusion of pegloticase. Okay, so pegloticase or pegloticase is a medication that takes 2 hours to infuse, so you're going real slow, 2-hour infusion, when all the other medications did not work, and this is for chronic gout only, okay? So there you go, baby. Now, I am excited because this weekend is the 3-day boot camp right here in Cleveland, Ohio. We are very excited to host people from all over the country, sometimes all over the world. We've had people from Canada, the UK, Saudi Arabia, but most of the time we get Michigan, Colorado, Florida, California, Texas, and a bunch of other states to boot. So we are excited. We can't wait to see you. Remember, we do have discount hotels. And what are we doing for those 3 days? Well, we're teaching you the test plan for the NGN NCLEX and how to pass NCLEX. We're giving you 8 packets, right? And if you cannot make November's, this weekend's date, which obviously might be hard, you still have January 17th, January 18th, and January 19th to consider. And so what do you get when you come all the way here to Cleveland, Ohio, and I torture you with everything that I can impart upon you to pass the NCLEX? Well, you get those pink packets. So you get the #1 study guide, which is the Oh My God packet. You get your reduction of risk, which is your procedures. That's the #1 area of failure with your basic care and comfort inside that packet. You get your management of care, 20% of NCLEX. You knew that. You get your infectious diseases, you know, contact, droplet, airborne, all that stuff. You get your pharmacology, but more importantly, you get the 2024 medication categories. Everybody loves that. We do a whole day on meds alone, so it's really, really good. And of course, we focus on psych meds because most meds on your test are from psych. And don't forget, we actually teach you EKGs. So listen, come on, join us. I'm excited and I can't wait to see y'all. Deuces.